Okay, so let's get through to it. This is just an overview of the TDM exam. So as I said, for the TDM exam, you should have completed your QE1. And for some provinces, all you need is the QE1, and they can invite you to write a TDM. For other provinces, you need to write a QE1 and the NACOSKI, and they should have, gone through your paperwork, especially for those who are going to do the practice-ready assessment. So this is not for those who want to get into residency. This is for those who want to get into practice-ready assessment, all right? Okay, so let's get to it. Let's get into this quickly. So why the TDM exam? The TDM exam is given or is written by candidates, and it is used to assess your therapeutic knowledge, your knowledge in prescription writing, your knowledge in, how to approach clinical cases in the context of medication, okay? And it is, when you are writing the exam, you are being graded on the level of a Canadian trained physician. So these are questions which it is believed that if we give the same questions to a Canadian trained physician, that person should score at least 75%. So even without, the person sitting down to study, if the person is given the question paper, the person should score about 75%, 70%. And that is the essence of, this exam. Now, where can you take the exam? Most people take the exam in Canada, like the way where you go to write your QE1 exam, and where you go to write your QE1 exam especially. But because of the nature of the exam, now you can also take it in your home country. So you can do it remote proctoring. You can take it in your home country. You can even take it at home in Canada, all right? Like the way people are taking the QE1 exam now. Now, when you're preparing for the TDM, what should be your emphasis? What should you focus on so that you can be able to ace the exam and make sure that you are passing the exam very well? Okay, so what you need to focus on in your exam preparation is you need to know how to apply your knowledge to make a diagnosis, because at times you'll be given a clinical scenario, and based on that clinical scenario, you have to make a diagnosis and treat the patient. Okay, another thing you also need to focus on is non-pharmacologic management of medical conditions. That is for the TDM. And then the last one is the pharmacologic approach to disease management. So if you know how you're going to make your diagnosis, if you know how you're going to say depression, what non-pharmacologic approaches am I going to use? Say anxiety, what non-pharmacologic approaches am I going to use? Then based on that, you can manage the patient very, very well. Okay, so remember that for your TDM, pharmacologic, non-pharmacologic, and how you're going to make the diagnosis. Now, the other issue with this exam is that, let me see, I think somebody is asking a question. Yeah, okay. So the other way you're going to have to see this exam is in the context of, what's the average Canadian doctor can do in the clinic setting, and at times in the hospital setting as well. So by the time you write this exam, you know that you are close to independent practice. And the level of this exam is such that if you pass it, or it's then ushers you into what we call the practice-ready assessment phase, where you then be invited, and you may do 3 months, depending on the province you are, where somebody is going to assess your competence, and after that, you are going to be allowed to practice in Canada. Okay. Now, the next exam dates in 2023, we have just one exam date more, and then the rest of the exam dates are in 2024. So in 2023, we have June 6th. That's the next exam date, and it's just 4 months away. We are now in February, so March, April, May, June. So I will not even add June to it. So you basically have 3 months to study for this particular exam this year, if you've been given an invitation. And then the next one will be in January 2024, and the next one will be in June 2024. So you realize that this exam is taken only twice a year. And I'm also going to tell you some other things about this exam. It is a very, very high stakes exam. The reason is because remember that I told you that it's going to be taken, the next one, the first one was taken in January this year. Or, yeah, I think February or so. We prepared about 18 candidates for it. And then the next one will be in January. You can only take the exam 4 times in your lifetime. 4 times. And you need a maximum of 2 pass results per lifetime. So this exam can expire. So when you are preparing for this exam, you also have to make sure that your documentation is right, so that you don't write the exam and keep it for, say, 3, 4, 5 years, and then it expires, and then now you have to take it again. Because if you pass twice, that is it. Okay. And you may attempt to retake the exam if you fail. However, you can't. So, for example, if you took the exam in January this year, you can't take it in June this year. You can only wait for 1 year. And you know all the problems with practice ready assessment, where they want you to be not to be out of practice for more than 3 years. Because if you have to take the exam and for whatever reason something happens and you have to take the exam again, and you have to wait for a year to write the exam, that's almost a year of your life, you know, being held because of one exam. So you want to give it your best shot. Okay. And it cannot apply to consecutive exam sessions. So you can't write the exam in January and then retake it in June. If you want to retake the exam, then you have to take it in January the next year. And it is basically focused on Canadian guidelines and best practices. And we're going to see some of them. So how are you going to be examined in this exam? The exam is going to cover a lot of the ground which QE1 covers as well. But this time it's going to be focused on management, disease management. It's that is where the emphasis is going to be. Disease management. And you're going to also be given cases in, you know, the acute setting. So emergency room management of cases. You may even be asked to write maybe some admission orders. You may even be asked, when are you going to refer a patient, when to consult a specialist about it. And the exam is also going to focus on chronic diseases. Now, the 4 main chronic diseases we deal with, and I know the other chronic diseases which may come up, but the 4 main chronic diseases we deal with in Canada, when we talk about chronic disease management, will be diabetes, heart failure, coronary artery disease, and COPD. So you want to make sure that, you know, you are very strong in the therapeutics of these ones. Non-pharmacologic approach to diabetes, non-pharmacologic approach to heart failure, pharmacologic approach to, you know, coronary artery disease. So you need to really know this very well. And the other chronic diseases like, you know, arthritis and all those ones as well. And you also have to focus, when you're preparing for this exam, on the safety profile of medications. Safety profile of medications. You need to really pay attention to it. So drugs which have interactions, you have to know common drug interactions. You have to know if I use ginkgo biloba with this particular medication, what kind of reaction am I going to get? These are the things you want to focus on. You also want to learn drug classes, because at times that question, and I will give you some examples of those questions. The question may ask you about, you know, drug classes instead of the drug name. You also have to learn how to write prescriptions in the Canadian context. And we'll be taking you through all those things as we journey on, okay? Aside that, you also have to learn the 2nd and the 3rd line medications. So all the time, you must know the 1st line medication. So if I ask you, what's the 1st line medication for migraine? You must know. What's the 1st line medication for otitis media? You must know. What's the 1st line medication for, you know, seizure? You must know. However, you may be told that, oh, you know, the patient has allergies to this particular medication. So that means you are going for the 2nd line and the 3rd line medications. You must also know adverse effects of the medications. Alternative therapies that people tend to use in Canada. So like ginkgo biloba, salt palmitate, you know, ginseng. Why do people go for these ones? And what's the indication for them? And which medications may interact with those medications if they use? And you also have to learn a lot about drug misuse and abuse. So you have to know the commonly abused drugs in Canada, like opioids, like benzos, you know, like medications like pregabalin, gabapentin, how to prescribe them, and when you're prescribing them, what instructions you need to give to the patient. This is basically a 3-hour exam. So it's a very intense exam. So all the studies you've done, you're going to pour everything in 3 hours. All right. And in those 3 hours, you have about 40 cases. It's 40 cases. However, they, in the long run, become about 100 cases. Why? Because each of the 40 cases may have about 2 or 3 stems under them. So if you have 40 times 2, that even brings you to 80. Some of them also have 3 sub cases. So by the time you are done, you have solved almost 100 questions in 3 hours. So you need to know your stuff, getting into it deep, so that you are not now thinking about, what to do when you are in the exam situation. Okay. So when you are preparing for the exam, what do I want you to focus on? I want you to focus on drug names, because the question can say, what drug will you use? I also want you to focus on drug classes, because the question can say, what drug class, instead of the drug name. So if the question asks for what drug class and you go and write the drug name, that is wrong. If the question also asks about the drug name and you go and give a drug class, that is wrong. Even though you are in the known, but you are not focusing on what the exam wants. You also have to know combination of doses, So if I combine maybe an SSRI with a MAO inhibitor, what complication can I get? If I combine, these are the things I want you to start focusing on and writing down when you're preparing for this particular important exam. And then the route of administration and the frequency of medication, okay? And how to write a prescription on a prescription pad. Admission, I've told you about all these ones already. Now, in order to ace this exam, there are some key points I want you to focus on, and I want to draw attention to some of them. So at times, the question will not just say, what is the treatment? The question may say, what is the initial management? The initial management of a patient with a particular condition may be different from the management you give when the patient is stabilized. For example, if you have a patient who comes in with, an acute condition, the initial management you give would totally be different from the management you give when the patient is stabilized. Another thing you also want to pay attention to is if the question intentionally gives you the patient's age. And at times, what can also happen is that they may give the age and they may give the weight. If they give the weight, and for example, if obviously they've given the weight, for example, in a patient with otitis media, a child with otitis media, you may know that, yes, amoxicillin. And if you go and write maybe amoxicillin, and amoxicillin has a dose range of 40 to 80 milligrams per kilogram per day in 3 divided doses. If there is a question which talks about maybe child who weighs this and is aged this and has an ear infection, what medication will you give? Write a prescription. If you will get half of the mark if you write, say, amoxicillin 80 milligrams per kilogram in 3 divided doses. So far as you be giving the weight, you are expected to use the weight to calculate the total daily dose, and based on the total daily dose, calculate how much the child is going to get every 8 hours. So what I want you to know is that at times when they throw in the weight, it is not just thrown in just like that. It is thrown in so that you can use that to calculate the exact dosing. And that is seen more in cases for children, okay? And you also have to know the medication name and the medication class. And what is the clinical context? If they say the patient came to the clinic, or if you were reviewing a patient in a long-term care facility, or you saw a patient in the emergency room. However, you also have to understand that some clinic cases can present. You also have to understand that some clinic cases can present in the emergency room, and some emergency room cases can present in the clinic. So, for example, a patient comes to your clinic and the patient collapses. What will you do next? You call for help. Like, if the patient needs an AED, apply that. But one of the management principles should be that you call for an ambulance to transfer the patient to the emergency room. If the patient there can also have a patient in the emergency room who may present with just ear pain. When you get something like that, know that even though the patient is in the emergency room, you are just going to treat the patient as if the patient was in the clinic. The other thing is you also want to avoid general answers like heart disease, No, heart disease is wrong. Don't say heart disease. If it is coronary artery disease, say that. If it is heart failure, say that. Don't just give general answers. For example, I also said an example here is don't just say thyroid disease. Rather use expressions like hyperthyroidism, hypothyroidism. Be specific. Be very specific in the way you deal with the patient. So I need some volunteers. So we try some questions. And then when we are done, I'll also give you some links to some questions you can try on your own. So I need a volunteer. If not, we can open it up for a discussion.
Yes, volunteer. I'm the volunteer.
Okay, Dr. So, that is good. Dr. So, what's your full name? Dr. So, SH. Okay, sure. So, Dr. So, can you take this question for us, please?
All right, perfect. So, a 79 years old woman presents with chronic back pain, adequately treated with acetaminophen. You perform imaging. X-ray reveals generalized osteopenia, a vertebral compression, fracture of L2, and wedging of thoracic vertebrae. What class of medication be prescribed for this patient? So we have 4 questions. Name one contraindication to this class of medication. The third question is, what potential long-term serious side effects of this class of medication should be disclosed before prescribing it? Number is one non-pharmacological intervention that should be considered for this individual.
So, Dr. So, you have this patient, back pain, being treated with acetaminophen. You perform an imaging. The X-ray reveals generalized osteopenia, and the patient has vertebral compression fracture of L2. What class of medication may be prescribed for this patient? Can someone? Yeah.
Well, so this patient has back pain, which is adequately treated with acetaminophen, which means that her pain is relieved. I mean, it's taken care of with painkillers. But the imaging studies suggest that she has a compression fracture of L2. Okay. We don't have the weight of the patient, so I can put her on. So at this age, the patient might need some calcium supplement, some vitamin D, and what else?
I've seen some answers. So you're talking about calcium, you're talking about vitamin D. Usually that means you are thinking about a particular condition. What condition are you thinking about?
It's osteoporosis.
Osteoporosis. So with osteoporosis, what medication is prescribed for patients with osteoporosis commonly in Canada? Bisphosphonates. You remember that? What? So exactly. So you realize that bisphosphonates, and the question.
I have a little bit flu, so I'm a little bit.
Sure. So the question is asking about, so the question is, look at the way the question was put. The question is not saying, the question is not telling 79-year-old patient came in with osteoporosis. No. It's rather put it in a way that you should start thinking that this patient probably has some osteoporosis of a sort going on. Okay, so now the other question is, name one contraindication to this class of medication. So now that you've learned bisphosphonate, what is one contraindication which is common that you must know?
Gastritis.
Someone says gastritis. What else?
Esophagitis.
Esophagitis. What else?
Chronic kidney disease.
Chronic kidney disease.
Sorry, I got disconnected. I'm sorry.
No, that's fine. That's fine. So we've learned bisphosphonates. We've learned the contraindication. Now, let me also say this. Most of the time in the exam, you realize that they'll give you about 5 spaces. Okay, they'll give you 5 spaces. So now, if they give you 5 spaces, and the first question is saying, what medication class will you give? Just write your first answer on the first line and leave the 4.
Is it like a CDM question?
Well, it looks like the feeling of CDM. It looks like it. It looks like it. It's the feeling of. It looks like.
But is it one of the exam structure? Like, is it one of the format of questions on the exam?
Yes.
Or it's just for discussion?
No, this is no. This is like the typical exam question. In the TDM, this is not MCCQE1. This is TDM. So one contraindication for this is what people are mentioning. Okay, so number 3, what potential long-term serious side effects of this class of medication should be discussed to patients before prescribing? What side effect is so serious that you want to discuss it with the patient before prescribing this medication? Yes, I've seen some answers coming through.
Yeah, jaw necrosis.
Beautiful, beautiful, beautiful. Now, list one non-pharmacologic intervention that should be considered for this individual. So you're looking at jaw necrosis as a complication you want to watch. So what one non-pharmacologic intervention will you want to consider?
Advise the patient for strengthening exercise, Tai-Chi exercise.
So exercise. Okay, good. So let's get into the answers. So what class of medication may be prescribed? Bisphosphonate. But I have a question. Apart from bisphosphonate, what other drug classes can be given for patients with osteoporosis?
I'm sorry to interrupt. What did you mean by TDM?
Antibodies, yeah.
TDM is therapeutic decision making.
Is it different than CDM?
Yes, it is different from CDM, clinical decision making. CDM is part of QE1. TDM is an exam on its own. You only write it, you're only given the opportunity to write it when you've passed your QE1 for some provinces, and for some provinces when you've passed both QE1 and NAC OSCE. Okay.
Oh, okay. So TDM is I live in Ontario. Okay. Is it in Ontario as well, or is it in Saskatchewan?
I don't know. I don't think Ontario has a practice-ready assessment program yet, but I know Saskatchewan has it, Manitoba has it, New Brunswick has it, Alberta has it, BC has
it.
Yeah.
Okay,
even,
I'm sorry.
Newfoundland has it. Okay, so let's go on. So what class of medication may be prescribed? We learned bisphosphonate. Name one contraindication. So the question says one contraindication. So don't give more than one answer. If it says one, so far as you say something like Barrett's esophagus, or esophageal stricture, or esophageal motility abnormality, or even achalasia. Some people also said chronic kidney disease, okay, impaired renal function, or if the patient is unable to stand or sit up for 30 minutes after drug injection, because it can cause a lot of emotion of the esophagus, then that is a contraindication. All right, good. The next question was asking what potential long-term serious side effect of this class of medication should be discussed to patients before prescribing. And I think somebody answered it beautifully, that osteonecrosis of the jaw, or just osteonecrosis should be discussed. So if you have a patient you are prescribing alendronate, resindronate to, you have to be seen to have discussed the issue of osteonecrosis of the jaw. Okay, and then list one non-pharmacologic intervention that should be considered for this individual: falls prevention, physical activity, and weight-bearing exercise. So while you're prescribing your alendronate and your bisphosphonate, like all those medications, you should not also forget about non-pharmacologic approaches. Now, let me also give you another strategy. When you are writing intervention, so if the question is asking you, what intervention will you suggest, or what treatment plan will you give? Always start with non-pharmacologic approaches first. Non-pharmacologic approaches first. So if the question had not broken things down, the question had just said, list one non-pharmacologic intervention, then you would have gone for fall prevention, physical activity, and weight-bearing exercise. All right, good. Let's go for another question. I want another volunteer. I need another volunteer.
Obada.
Beautiful, Obada. Let's go, Dr. Bada. Thank you very much for that.
No problem. All right, a 30-year-old man sees you in your office complaining of low mood for the last 3 months.
He had a previous similar episode 7 years ago. He cannot concentrate at work and he has insomnia. After questioning him, you diagnose with a major depressive disorder.
Dr. Bada, before you continue, so you realize that for this one, the question stem has given your diagnosis. In fact, it could also be that we could take the last sentence away and it will just say, what 3 non-pharmacologic steps would you consider? You know, so the question will expect you to know that this patient who has low mood, who has had it previously, has depression, and what you're going to do. Okay, Dr. Wada, let's go, please.
All right. What 3 non-pharmacological steps would you consider? Should I read the other questions or should I answer?
Sure, if you want to answer, that would be great. I'll be very happy.
3. I would consider, for example, psychotherapy, or cognitive behavioral therapy as a non-pharmacological step. Sleep hygiene for insomnia, and exercise.
Beautiful. Now, Dr. Bada, before we move on, I know
Yes.
this is not part of the question, but I want us to also delve in there because sleep and insomnia is also very big in Canadian practice. Can you give me 5 or 3 non-pharmacologic approaches for sleep, for insomnia?
In case of insomnia?
Yes, sir.
So mainly we focus on sleep hygiene. So we advise the patient to sleep at similar time every day. We also advise the patient not to drink caffeine for a period, a few hours before sleep.
Beautiful.
We advise him to sleep in a dark room without television.
Beautiful.
We advise him also not to do activities in your sleeping room. So only put the sleeping room only for sleep, not to study or to eat or to do stuff, others.
Powerful, powerful. So that means, you know, you've covered your basis in insomnia as well, the non-pharmacologic aspect. So what you need to learn is the pharmacologic aspect. And, you know, the exam is straightforward, straightforward. Don't go and learn any highfalutin stuff. These are the things, common presentations in Canadian practice. Okay, so let's go to your second question then.
You decide to prescribe an antidepressant medication. What would you ask him to make a follow-up appointment? When would you ask him to make a follow-up appointment in your office?
Beautiful. When are you going to do that?
I'm not sure about the exact period, but I would say within weeks, but I'm not sure about maybe within the period that the drug will take the place. Like the drug will have the effects. Will have the effect of like 4 to 6 weeks.
Yeah.
Well, some will say 4 to 6 weeks, and then you realize that when we are done and we are reviewing it, you realize that when you start a patient on antidepressant, we want to have a short-term follow-up, about 1 to 2 weeks first, and then 4 to 6 weeks as well. Because 1 to 2 weeks, you want to monitor the patient's mood because most of the time, their energy gets higher while their mood is low. And that is the time they are at risk of causing suicide. And then usually you also want to set up another appointment by 4 to 6 weeks. Beautiful. So let's go on. How long would you continue this prescription if it is effective? Exactly. So can you help us with that, or can anyone help us with that? How long would you continue?
6 months. 6 months.
1 year.
12 months, I think. 12 months.
Okay.
6 months.
So we are the jury is out. So the first question, Dr. Bada, thank you very much. So what 3 non-pharmacologic steps would you consider? Number 1, you want to ask about suicidal ideation. Number 2, you want to ask about family or other support. You know, so even though we are talking about therapeutics, we're also looking at even the social dimensions of care. And you also want to exclude hypomania. You want to make sure it is not something which has been going on, you know, and you want to exclude hypomania. You want to make sure that there is no bipolar component, because it could be that the patient is just presenting with a depressive side of bipolar. So you also want to ask, are there times your mood comes up? You know, you want to make sure that your diagnosis is right, because the way you're going to manage a bipolar patient is different from the way you're going to manage an out-and-out depressive patient. Beautiful. Now, you decide to prescribe an antidepressant. When would you ask him to make a follow-up appointment to your office? As I said, I know a lot of people are writing 4 to 6 weeks. That is right. However, in practice, when somebody starts an antidepressant, you want to have a short-term follow-up with them and then another one by 4 to 6 weeks, because by that time, the medication effect would have kicked in. And if it's not helping, that's when you want to adjust the dose. But usually by the 1 to 2 week, you want to assess for suicidality, all right? And then for how long would you continue this prescription if it's effective? At least 24 months or 1 year, and 1 to 2 years, okay? Yeah. Let's go to this other question. Dr. Bada, would you want to continue, or will somebody else want to continue for us?
I can if nobody will.
I see a conversation going on there. So Dr. Tassinen is saying, but he had previous episodes 7 years ago, so he's going to need a longer time. Awesome. Most of the time, if the person just had an initial, presentation of depression, you want to go for 6 to 1 year. But remember that the question said that the patient had it 7 years ago. So this time you want to go for a longer period. Dr. Tasman, awesome. So that's why we went for the 24 months instead of the 6 months to 1 year. So you have to pay attention. And that's one trick I'm going to teach you when we are going through the course. Okay, Dr. Bada, let's go.
Yes. A 40-year-old woman with severe rheumatoid arthritis has been treated with high-dose steroid, prednisone, for 6 months. Give 3 potential side effects of these medications.
Beautiful. So a medication like opioids, a medication like steroids, you must know it. So, there are about 20 side effects of steroids. Dr. Bada, can you give me about 10 of them?
Yes. Osteoporosis.
Let's go.
Osteoporosis.
Sure.
And cataract.
Okay.
Hypertension. Psychosis. Glucose intolerance.
Beautiful.
And hypernatremia also, or hypokalemia.
And then easy bruising.
Yes.
You talked about cataract. What else?
Truncal obesity.
Truncal obesity, easy bruising, glucose, poor handling of glucose, right? So gastritis. So you have Cushingoid states, osteoporosis, hyperglycemia, a lot of answers. As I said, if the question asks you for 3, give 3. You may see that there are 5 lines. If the question asks for 3, give 3 and leave the 2 out. Okay, good. Let's go on. So, I want to give you some final tips. So one other thing I want you to pay attention to is time management. Because as I said, even though there are 40 stems, eventually you'll be answering about 100 questions. So that means you're doing about 100 questions in 3 hours. So that means you must know your stuff to the extent that you are doing one question every 1.8 minutes. You can't delay. It comes quickly. Go like, oh, I'm going for my TDM. By the time you realize, oh no, the time is up. And be as brief as possible. Okay. Some questions demand just 1-word answer. Some also demand a short answer. Just give it and go. And be specific. As I said, don't say thyroid disease. Rather say hypothyroidism. Say hyperthyroidism. Say Graves' disease. Don't say heart disease. Rather say coronary artery disease. Say heart failure. Okay. And don't over answer. If they ask for 3, give 3, because they are not going to mark the rest of the answers you've written. So if you have the best of your answers is number 5, they'll just mark the first 3 and then they'll leave the rest. Okay, so please put your best answers first. Now, 1 answer per line. And unless the question states, which is most of the time not likely, that states a drug range, don't state a range. And in relation to even timing, don't state a range. So if you want to prescribe, say, amoxicillin, 500 milligrams 3 times a day for 7 days. Don't say amoxicillin 500 milligrams 3 times a day for 7 to 10 days. No. If according to the marking scheme, the prescription can go for 10 days, can go for 7 days, can go for 8 days. So far as you write one of them, you are correct. And if they give you weight, as I was giving an example, if they give you, say, baby Smith comes in with something, and then the weight is this. In reality, what they want you to do is to actually calculate the dose. So you must be able to calculate the dose and use that as your final answer. Don't go writing 40 milligram per kg when they've told you that the weight is 18 kilograms. Use the 18 kilograms to do your calculation and then write your final answer. And the other issue is that what about spelling mistakes? If you make a spelling mistake and we know exactly what you are driving at, you will still get your answer correct. All right? So my point to you and my encouragement to you is, let's keep calm and ace this exam. Let me see, how long are the stems usually? So how long are the stems? So some of the stems can be 2 stems, some of them can be 3 stems. So that's why you could see that the questions we just solved, Dr. Khadija, the questions we just solved, this one was just 1 stem. So I've just given examples of those ones. This one was 3 stems. Some of them can also be 4 stems. And eventually you get about 100 questions you are answering.